Right, we're still in Women's Month here in South Africa, and we continue to shine the spotlight on various areas and various aspects of things that affect women. Now, the Thuthuzela Care Centres were established in 2001 as an integrated strategy for the prevention and support for victims of gender-based violence. With 65 centres located across the country, their aim is to provide psychosocial, medical and legal services to victims of gender-based violence in a victim-centred approach. Now, over the years, the Thuthuzela Care Centres have been instrumental in the prosecution of over 200,000 cases. To talk to us more about the role of the Thuthuzela Care Centres, we're joined virtually now by Advocate Bonnie Currie-Gamwo, who's National Prosecuting Authority's Special Director of Public Prosecutions, Head of Sexual Offences and Community Affairs Unit. Advocate Currie-Gamwo, thanks so much for your time. Welcome to Morning Live.
Good morning, Sakina.
Perhaps we should start by way of reflection, by just looking at the work that is being done by the National Prosecuting Authority Sexual Offences and Community Affairs Unit in support of survivors of gender-based violence.
So the Sexual Offences and Community Affairs Unit was established specifically to deal with gender-based violence. So we manage the gender-based violence mandate of the National Prosecuting Authority, which indicates, Sakina, the prioritization which the National Prosecuting Authority gives towards fighting gender-based violence. So the unit itself focuses on developing and implementing best practices, all geared towards optimal management of gender-based violence cases in this country. Training also forms a huge part of what we do. So when we say gender-based violence, we now include maintenance, we include sexual offences, but also domestic violence and also child murders, for example.
And of course, the Thuthuzela Care Centres, as I had indicated in the introduction, Advocate Currie-Gamwo, were established in 2001 as an integrated approach to all the things that you've just mentioned. It's meant to be a rape care management centre. It includes providing all those services that you spoke about, including the psychosocial, medical and legal services to survivors. In your view, how successful have they been since then?
I think to understand how successful it has been, Sakina, one needs to look at what was the status quo before the introduction of Thuthuzela Care Centres in the country. And so before we had Thuthuzela Care Centres, the path that a victim of sexual offences had to travel and to endure was not really victim-centred. The victim would have to go to a police station and report, as would anyone else reporting crime, often in an overfull, very busy police station. And thereafter, be taken to the emergency section of a hospital, again, overfull. And they had to queue. There was no prioritization because it was a victim of gender-based violence. They had to join the queue, spend hours on end, and then, psychosocial support was not done as a norm. With the advent of the Thuthuzela Care Centres, what government did was make everything or do everything possible to ensure that it is a victim-centered approach which is adopted. And that is the Thuthuzela Care Centres. So at the Thuthuzela Care Centres now, the focus is on the psychosocial support of the victim. It's the first step when they come in, before we even do the medical or the legal services. So it's been a complete 360 in terms of the pathway that a victim of sexual offences in this country travels. But I also want to just make one point, Sakina. Yes, the Thuthuzelas were introduced as an anti-rape strategy then. Since 2021, we offer services to all victims of gender-based violence. So even if it is a non-sexual violence that was perpetrated against the victim, they too can seek help now at the Thuthuzela Care Centres. So that is the most important impact of the Thuthuzela Care Centres.
And speaking of that help, Advocate Currie-Gamwo, can you just take us through the process that happens from the time that the survivor makes the choice to report and pursue justice by using the services of a Thuthuzela Care Centre? How does it unfold?
Okay, so we have what we call a 6-step process, Sakina. The victim will enter the Thuthuzela Care Centre, where they can now report that they are a victim of gender-based violence. The second step is then that psychosocial services will be given to that victim, as well as, and that's primarily for trauma containment, because you can imagine when the victim enters, what that victim, the state that victim is in. So we do the trauma containment. We also then do the medical, or provide the medical service, which is in the form of the collection of the forensic evidence, but it is also, Sakina, the provision of very important medication to prevent pregnancies, to prevent diseases, etc. The next step is then also to provide even more ongoing counseling to the victim. A once-off trauma containment isn't enough for a victim of gender-based violence. So built into the system is the ongoing counseling, which we know a victim of gender-based violence requires. The next step, Sakina, is for the victim to report, to open a docket, right? So what we have done, we've engaged with the police, who has agreed that the victims can now actually open a docket at the Thuthuzela Care Centre and not have to go to the police station to do so. Again, part of that victim-centered process that we try to have in the Thuthuzela environment. The next step again is the ongoing counseling services. It's a thread that is throughout the services which is offered at the Thuthuzela Care Centre. The next step then would be that once all of that has been done, docket has now been opened, we have TCC state advocates at our TCCs, and their role is to take the docket and make the docket trial ready by prosecutor-guided investigation with the police, as well as the consultation with the victim as well. And important, the TCCs are court-directed. So everything that we do in this entire chain and following the 6 steps is to get justice for the victim, because we believe as the NPA that when you seek this justice, when you give all of these services to the victim, you have now turned the victim into a survivor who is an empowered victim who is able to tell their story in a court of law. But I must urge and say that we do not force victims to open a docket. If you are not ready, if your trauma does not allow you to want to pursue a prosecution, we do not force anyone to pursue it, because that would be part of secondary victimization. But in South Africa, we do not have any prescription in respect of the prosecution of sexual offences. So you can come back and we will preserve the evidence. And when you are ready, and if we have a case, we will then be able to proceed with the prosecution.
So currently, and I'm glad to hear that, because there's nothing as disconcerting as having to walk into a police station and you have a victim of gender-based violence who's there out in the open and becomes, this a spectacle almost of everyone who walks into the station. And as you say, is then even in that instance exposed to secondary victimization. So glad to hear that. But where can people actually find the Thuthuzela Care Centres? Because I understand there are 65 centres in the country. Where exactly are they situated?
They are situated in each and every province in this country, Sakina. and they are situated in both urban as well as peri-urban as well as the rural areas, because we try and have a TCC located wherever, so that we are able to provide services to across the spectrum of victims. So location should not prohibit you from being able to access a TCC. You can now Google Sakina and go on to even the Department of Justice, even the NPA's website, and it will give you all the locations of all the Thuthuzela Care Centres in this country.
And, just want to go back on something that you touched on, Advocate Currie-Gamwo, with regard to survivors and sometimes not being able to go ahead with, the case where the prosecution process then is stalled. Now, in that instance where people perhaps are fearful of various things, including secondary victimization inside the courtroom, as the institution of justice, as the Public Prosecution Sexual Offences unit, how do you support people? You did say they can come back whenever they are ready, but how do you support them in that instance?
Okay, so very recently, Sakina, we've had the passing of very important GBV legislation, which offers even further protection for witnesses in our cases. And we also have still the Criminal Procedure Act, which also offers further protection for someone who gives evidence. And that protection really is in the form of the victim being able to testify via an intermediary, a victim being able to testify via the closed circuit TV that are throughout our country at the courts. That is a very, very important protection, because it means that the victim does not need to face the perpetrator again. What we have tried and are trying to do currently, Sakina, is that we are trying to embark on an initiative where we are able to let the victim, as well as the personnel at the TCC, be able to testify from the Thuthuzela Care Centres. This, of course, in keeping with the virtual hearings that have been happening in the criminal justice system for a while now. And we would love to be able to create that safe space at the Thuthuzela Care Centres, where we are able to provide even an additional service to the victim when it comes to testifying in a court of law.
Advocate Bonnie Currie-Gamwo, fantastic work that you are doing, and I must say have had obviously the privilege of being at the opening of one of these newly revamped Thuthuzela Care Centres, and really lots of work and care going into that. But thank you so much for your time, Advocate Bonnie Currie-Gamwo, the NPA's Special Director of Public Prosecutions and Head of Sexual Offences and Community Affairs Unit, talking to us about the role of Thuthuzela Care Centres in supporting survivors of gender-based violence. So as she indicated, you can go to the website of the Department of Justice or that of the NPA, and you should be able to locate where your closest Thuthuzela Care Centre is.